So, Dr. Nami, how does oral health play into whole body optimization for things like energy, sleep, and performance?
One of the things I have discovered in my 20 years of practice is that I have certain patients who are just thriving and doing really well and when it comes to health. And also science has proven so many wonderful things. If you are somebody who's interested in biooptimization or biohacking your body to avoid diseases as you get older, dentistry is crucial because it's really important in two most important ways. Um, of course, no root canals, of course, brushing your teeth, all of those things are really a given. But the new information that's really exciting is really looking at the microbiome and testing it. We can now test a specific bacteria that is in your mouth that causes heart attacks, diabetes, cancers, Alzheimer's, arthritis, and many other diseases. And on top of that, we can actually test your immune system, so your genetics. So, what we can see is what your gene marker is, what mom and dad gave you, which is, are you at high risk for inflammation and disease, or are you at low risk for inflammation and disease, or are you medium risk? When we have this information, number one, with information about the bacteria plus how your immune system works, we can really focus on your environment and what you can do with confidence about how to help prevent heart attacks, diabetes, cancer, Alzheimer, arthritis, and biohack yourselves and biooptimize yourself. Now, let's take that a step further. We can look at your biomarkers through your saliva. That's number one. The second is we can actually optimize you in the most amazing way through making sure that we can expand your 3D nasal volume. That means expanding your sinuses and expanding your nose, absolutely. And as we do that, we create this molecule that is naturally created by our bodies. We increase your body's capacity to increase more of it. And the way we do that is there's a product called nitric oxide. Your body actually makes it on its own when you breathe through the nose. So you can imagine that once we expand the 3D nasal volume structurally, it actually gives you an oxygen advantage. It gives you a nitric oxide advantage. So, what you're actually able to do is give your body your own ingredients and put it structurally in the right place, so that you can live long and you can bio optimize. What has happened in the last, throughout evolution, actually, is our ancestors, when we were in the primate species, when we were gorillas and monkeys, our sinuses were really big. In fact, if you look at one, you'll see that they have these really big nostrils, right? The reason for that is because when we were closer to the ground, our sinuses were really big and our heads are smaller. But what has happened throughout evolution is that our sinus cavities have become smaller and our heads have become bigger. And that's how we can create things like AI, put people on the moon, and just do these amazing things. So, what we want to do now is combine that, right? We want to keep our brains, we want to increase capacity. We also want to increase our sinus cavities and that functional airway and increase the amount of nitric oxide our bodies can naturally create through breathing.
So, tell me a little bit more about that mouth, gut, and brain connection and the role that it plays in biohacking longevity and vitality.
Well, that's another great question. And so earlier I mentioned to you, we now know the specific bacteria that can cause disease. We now know how your genetic system works. We can control your environment. And the beauty of that is as we do that, we talked about nitric oxide just a couple of minutes ago. We now know you can make nitric oxide a lot more if you expand your sinus cavities. Now, the second way to increase nitric oxide in your system is by making sure you have the correct microbiome, this good bacteria in your mouth. And when you have the good bacteria, which is absence of the bacteria that cause heart attack, diabetes, cancer, Alzheimer, arthritis, you will actually have good bacteria that helps take the food that we eat, like the green smoothie or a salad. It's going to help you break that down and convert into nitric oxide in your stomach. So, do you remember nitrogen fixation when we were children? We had to learn that whole cycle. So, when it comes to our bodies, we actually have to break that nitrogen down into the molecule that actually is functional, that's actually going to work. And the way we do that is take those food, it's grown in the soil. That soil gives it nitrogen, right? And so we have nitrate, which goes into nitrite, and we got to turn it into nitric. So the process of that occurs is you put food in the mouth. There's bacteria inside the mouth help you break down the food, and you add the stomach acids to it, and then the food goes into your duodenum or your intestine where it's actually absorbed. And in those in that area where it's absorbed is really critical because that's where the nitric oxide can be maximized. So that again, you can biooptimize yourself, biohack yourself with food. We want to biohack you and biooptimize you with air. We also want to biohack and biooptimize you with food.
So what are some of the dental practices that you recommend that support all of this and support peak health?
So, some dental practices that I recommend is going to number one, always make sure you're hydrated in the mouth. So, making sure you have a mouth that is not dry. So, dry mouth tends to increase the bacteria that causes heart attack, diabetes, cancer, Alzheimer, arthritis. The other concern is sleep apnea, because that again is you're not breathing through the nose, you're breathing through the mouth. So, nose breathing, highly recommended. Making sure that you're obviously brushing, flossing, keeping the microbiome clean is really also very, very, very important. The other thing that always really helps in this, I love to do, is before you go to sleep, I would recommend that you floss first, brush your teeth, take some coconut oil, rub it on your gums, and then mouth tape vertically. Because as you rub the coconut oil on the gums, you're making sure the mouth is not dry. When you're putting the mouth tape, you're ensuring that you're nose breathing. So, again, creating that second source of that nitric oxide.
Are there some specific advanced diagnostics that you have available at your practice, like maybe like microbiome testing, 3D imaging, things like that, that might help to optimize oral health?
Absolutely. We do both, actually. We do several things. Number one, we definitely always test a microbiome. We test the genetics to see how the body is responding and what we need to do to change you. And then we do a CBCT, a 3D scan of the nasal volume, not just here, but we look at is the sinus cavities. We look at the tongue position and also the windpipe to make sure that entire functional airway is in the proper shape. And in addition to that, we actually like to look at your blood work. We also like to check your levels of vitamin D3 and B12. When vitamins D3 and B12 are in order, D3 is really great because it is a precursor to all your hormones, all the testosterone, the estrogen. In fact, D3 is just so important because it's pretty much in every pathway we can find. So we really check vitamin D3. We also check vitamin B12 because when you have D3 and B12, it not only ensures that you have a good microbiome in the mouth, but it also makes sure that you have a good, healthy microbiome in the gut. And that way we can prevent, a leaky brain or a leaky gut and a leaky mouth.
Are there some additional daily routines? You mentioned, rubbing your gums with coconut oil. Are there some other things like that that biohackers can adopt to stay ahead of the curve in between visits to the dentist?
Absolutely. The other thing I want to add is, the one thing we can control is our environment, right? Genetics, we don't have much control over. So when it comes to increasing the amount of nitric oxide, the most important thing to do is lots of leafy greens. So my favorite thing to do is have lots of green smoothies. Green smoothies are great because they're loaded with nitric oxide and fiber, and it really helps your mouth, your gut, and it works really well for all your cellular functions. It also helps pull out toxins, because as your body is eating all this good food that doesn't have a lot of chemicals and doesn't need a lot to break down, your body has more reserves to function better. It has more energy and time to be able to pull out toxins. It's not busy breaking down food, it's actually having time to regenerate. And the green smoothies, green salads, seeds, nuts, all of these things have really great ingredients that your body actually needs in order to function better. So that way it can use ingredients properly and bio optimize you and biohack you.